Bismillah ar-Rahman ar-Rahim. We're ready to start this very stimulating sessions about endodontics. We're proud to start with our first speaker for today, Dr. Zveri. She's she's a lecturer in endodontics at the University of Lithuania Health Science Center. She has a very stimulating title here today that is Adverse Reactions of Sodium Hypochlorite Risk Management and Treatment. So please do welcome Dr. Zveri.
Okay, thank you. Hello, everybody, in this afternoon. So, as chairman told me, I am Dr. Živilė Grabliauskienė. I came from Lithuania. Will not boring you about tales about Lithuania. Who attended this conference last year knows already that we don't have beers, that we don't speak in Russia. So, but first of all, I want to thank you, all of you, of attending my lecture. And it was very nice, as 2 days ago, Professor Ahmed told me, welcome back home. So thank you for hosting me. So everyone from us should have a goal. This slide I put just 1 hour ago. And my goal for today, it doesn't work. Oh, no. Oh. It's somewhere. Okay, change the computer, please. So my goal for today to have a lecture in Alhambra Hall. Why? First of all, I want to say that when I was first time in Cairo, it was in Panarab in 2017, was so cold everywhere, in all the halls. I was freezing. Even me, for a person from north, was so cold. So, but in this hall, it's too hot even for me. So I wish to have next year Alhambra Hall. I didn't put this.
Think. To put your screen down a bit so you don't lose the battery.
So, not one dream is too big and not one dream is too small. So I hope my dream will come true next year. So now about more serious thing and maybe more scary thing. If you remember last year I was talking about irrigation, and I am actually a fan of irrigation. If we're talking about endodontic treatment, usually we can talk briefly. There is two diagnoses, a pulpitis and periodontitis. These two diagnoses or two diseases could be treated only in one way, to do endo treatment. And the main goal of endo treatment, look, even the endo treatment has a goal, is to reduce infection, and mainly is reduce infection by irrigation. So I put intracanal medications very small, because if you ask me about intracanal medication, I don't like it. I'm talking about the calcium hydroxide, but it's only my opinion. So we know many of slides we have seen today and yesterday about difficulties of internal anatomy. And you cannot imagine what kind of instrument can clean this system, canal system. There is no any instruments. So 100 years ago, one Russian leader of revolution told, study, and always study. I was studying in the Soviet times, and all my classes at my school was the picture of this leader, and was written everywhere, study, and study. So I did the same. I put irrigation, and I'm telling you, irrigate, and always irrigate. So only after irrigation, as I used to say, I open my tooth or tooth canal chakras, and you can get a full 3D obturation. So now, nowadays, the sodium hypochlorite is the most commonly used root canal irrigant. So what is the advantages of this sodium hypochlorite? First of all, it's a very good antiseptic solution, an expensive lubricant, dissolve vital and necrotic tissues. And I made in my clinic like a trial. I remove the healthy, inflamed pulp from the tooth canal, put in a plate, and put on this pulp tissues small amount of sodium hypochlorite. What happens after 1 hour? It disappeared. And of course, I was shocked. I started to scream on my assistant, who steal my pulp? It was like my trial. And everybody was shocked, and nobody was stealing your pulp. So in 1 hour, it's very easy experiment how can sodium hypochlorite dissolve pulp tissues. Dissolve organic substances present in the root canal system. Maybe it's better to stand here. Yeah? No. Yeah. For proper antimicrobial activities must be prepared freshly just before use. What I'm telling to my assistant, please, if I will have endo, please bring me sodium hypochlorite from refrigerator. So it should be kept in cool and dark place. So, but despite all advantages that sodium hypochlorite has and we are still using, it has many of disadvantages. So, first of all, it's cytotoxic. Foul smell and taste. It's a simple thing, I said. Nobody can die from the bad smell and taste. Ability to bleach gloves. It's very, very sorry that this ability is permanent. So it's for dentist, for assistant, and for patient too. I just remember one case when I destroyed a jacket of one lawyer, lady. So I did root canal treatment endo for molar for her for free. I'm sorry about this jacket. Ability to cause corrosion on metal object. Does not kill all bacteria. Does not remove the smear layer. So we should use another irrigation. One of its disadvantages is eye damage. What's the risk? Can result endophthalmitis and subsequent loss of the eyes. How we can imagine it? Immediate ocular irrigation with a large amount of just tap water, 15 minutes with 1 liter of water, or sterile saline is required, followed by an urgent referral to ophthalmologist. And use of adequate eye protection during endodontic treatment. So the eye protection usually we're doing, all the dentists working with eye protection, or working with microscope, it's the same eye protection. But what we should do on the patient, the same to put glasses on patient. Another disadvantage is damage to skin. So can cause skin irritation. So what you can do, just irrigate skin with the tap water. And prevention, cover the patient. The same, I don't know what is in Egypt, but in Europe you can buy some big covering, so to cover shoulders of a patient, not to destroy jackets or shirts or whatever. Damage to oral mucosa. I hate this. Surface injuries caused by the reaction of sodium hypochlorite with protein and fats of mucosa, and can build some layer. This is very difficult to wash with water. No. Only one thing that I ask from organizers, laser. Rinse, as simply what we can do, rinse mouth with water. If a patient starting to do something bad, said, no problem, we will not die from it. Just we will rinse, assistant will make a section, and that's all. Prevention, rubber dam is obligatory. So let's say in some countries like United Kingdom or United States of America, it's obligatory by law. So, rubber dam. Allergy to sodium hypochlorite. Actually, in 25 years of my clinical practice, I haven't met a patient with allergy of sodium hypochlorite. But anyway, you should think about it. So what could be? May include urticaria, edema, shortness of breath, bronchospasm, and hypotension. Before starting endo treatment, is advised for you to ask patient about the hypersensitivity to household bleaching materials. And I think so in 1976 was done first allergy skin scratch tests on sodium hypochlorite. So if there's any risk of allergy, so do this allergy skin scratch test. In that case, the patient required urgent hospitalization in the intensive care unit and management with intravenous steroids or antihistamines. So if we talk briefly about what is going on inside the canal or about endodontic treatment, the worst thing is extrusion of sodium hypochlorite into periapical tissues. And who visited Professor Roland de Moore lecture saw how it's easy to push the sodium hypochlorite through the apex. It's interesting that 42% of responding endodontists in USA had experienced at least one sodium hypochlorite accident during their practice. Actually, the true frequency of such accidents is unknown, as many of them may not be reported. Who wants to say that he did an accident and the patient just hospitalized? Minor extrusion incidents might even remain undetected due to absence of severe symptoms. Maybe the patient is complaining about such pain after endodontic treatment. It could be not about inflammation, like chronic inflammation of apical periodontitis, or maybe it could be that you extruded some amount of sodium hypochlorite beyond the apex with no severe symptoms. 39% of accidents, the possible cause of extrusion was not discussed at all. It's mentioned, I found in literature that for women it's easy to do it. It's more in anterior teeth, in maxilla jaw, and especially in cases with periapical lesion. Usually, if diagnosed with apical resorption, where is a destruction of apical constriction and, of course, perforation, or in bifurcation area, or it could be lateral perforation. The same wide apex. I have some researches done that it shows that if we have apex size number 50, 6% conicity, it's 60% often can be extruded sodium hypochlorite compared with apex number 35. And the same, here's the difference between number 40 and number 60. The difference is very, it's much more often can extrude when apex is wide. But be cautious, because the 5.25% of sodium hypochlorite showed great capacity to extrude beyond both intact and even small size apical foramina. It means if you have a very narrow canal, let's say size 25, it's the same. It's possible to extrusion of sodium hypochlorite. Aggressive irrigation. It's recommended to use or to handle your syringe in this way. In this way, when you are pressing with your second finger, it's not so much pressure on a syringe compared when you are pressing with first one. What symptoms? First of all, pain. It's sharp, immediate pain. Acute, it could be acute, sharp, or medium. Bleeding from the root canal, from the orifice. Local or diffuse tissue necrosis, it's called chemical burn. Progressive swelling, ecchymosis, gums necrosis, neurological complications such as numbness or weakness of a facial nerve, and secondary infection like sinusitis or cellulitis. And sometimes paresthesia, it's forever. It like lasts for this patient, let's say. It's for whole life. The complexity of the complication depends on two. First of all, of sodium hypochlorite concentration and solution pH. Of course, we know that biofilm, it's easy to remove when we're using a high concentration of sodium hypochlorite compared with lower concentration. A continuous change of sodium hypochlorite and higher concentration seems to have more effect of biofilm. And there is many researches done that if you want to have a good antibacterial effect, you can use more concentrated solution. But the balance should be between safety and effectiveness. So there is many research done that even if you use 0.5% of sodium hypochlorite, you can get a good treatment results. So think always in your position, on your patient position, what is better, more safe or more effective? So if you want to have more effective irrigants and to low concentration, do this irrigation activation. So it can increase action by this hydrodynamic effect. You can use or gentle wave or ultrasonic activation or sonic activation, doesn't matter. So, but even if you can use 0.5% of sodium hypochlorite, it the same could be cytotoxic. The same is depend on irrigant volume and exposure time. It was done researches very interesting about low volume and high volume. It was two instrumentation system, reciproc and BioRace, XP and Shaper, and it was founded that to use high volume, it's better to remove bacteria compared with low volume. So instead of high concentration, it's better to use a big amount of volume and lower concentration. And the same exposure time. We should keep this sodium hypochlorite as much as longer in the canal. So refresh all the time and keep it longer. Our instrumentation systems allowed us to do endodontic treatment or, let's say, shaping of a canal very fast. So please pay more attention to safe irrigation. So how to manage this situation if you had an accident? First of all, don't panic. Proper management of sodium hypochlorite incidence is important to achieve the best outcome. That I was looking for some guidelines or some statements or from American Dentist Association or a European Association. There is no guidelines how to manage it or how to treat. Time is a crucial factor in reducing the destructive effect of sodium hypochlorite. So, first of all, timely notice a problem. Wash immediately with big volume of water. Calm down the patient to inform about the causes and consequences of complication. So usually what we're giving to sign for patient agreement for treatment, and in this agreement should be written this complication, like accident, extrusion of sodium hypochlorite. Provide the patient with oral written instruction on how to take medication at home and perform assigned procedures. To assign a patient for follow-up, it's very important to have a patient follow-up. Usually, all the swelling, redness, hematoma, it disappears in 2 or 4 weeks. So the treatment. First of all, we should reduce swelling. So what to do? Immediate irrigation with normal saline or simple water, add much water. Allows the solution and exudate to filter out through the root canal orifice. So let to go all these liquids out from the canal. Cold pack to relieve discomfort and reduce edema. So what I'm used to say for my students, if you had an accident, first of all, rinse, put a cold pack, and after that, sit on the computer and Google what to do more. Because usually it's very difficult to remember all the treatment steps. After about 6 hours, it depends on the literature. In some literature, you can find that after maybe 24 hours, after cold packs, you should change to warm packs. And steroid may be used to minimize edema. So the same is very important to control pain. So local and oral analgesics may be helpful to alleviate a pain. And to prevent secondary infection, you can prescribe antibiotics. In more serious cases, referral to a medical center. So it's, of course, always is easy to prevent than to treat. So prevents, first of all, a correct working length, apex locator, a ruler, not too large, too much apical foramina. Yesterday we were talking about this, the size of apical foramina. So not too large, too much. Working with optic, use X-ray control to avoid perforations. In case of attendance or allergy, to change an irrigant. So it's not to use no irrigant. Of course, you should do irrigation, but maybe to change from sodium hypochlorite to chlorhexidine. And according to some trials, you can get the same good results because the same is has an antibacterial effect, sodium chlorhexidine. Okay. Prevents. I call this chapter like right irrigation. Right irrigation consists of shape of irrigation needle. You know that there is a two type of needles, closed and open needles. Of course, with closed needles, we can prevent extrusion, but we cannot clean the apical part. So the safe, look about safe and effective. The second, size of needle. We usually use number 30 coach of needle. The same, it's for right irrigation is very important. Material from which needle is done. It could be stainless steel, nickel titanium, or the new ones called IriSafe from plastic. Irrigation syringe. There is a many amount of syringes from 20 milliliters, 10 milliliters, 5 millimeters, and some things that you cannot use in endodontics. So if you want to have faster work, you can use or 20 milliliters or 10 milliliters syringe. But I prefer to use 5 milliliters of syringe. It's more safe for irrigation. Irrigation system. If you want to have a safe irrigation, you can use negative pressure irrigation or gentle wave technique, but you cannot do direct pressure into apical foramina. So usually what I'm doing, I'm showing my failed cases. And the same when I started to talk about adverse reaction to sodium hypochlorite, why? I did this. So it happened with my patient. A 33 years old woman came into my clinic for retreatment of first molar. What is it interesting that this molar was treated long time ago without any symptom, without any radiolucency, without nothing, and it was called Russian red or resorption formalin tooth. So I started the treatment and was very perfect, everything so palatal and distobuccal canal, but the mesiobuccal canal was curved, and I did perforation. If a file was broken, yes, I didn't break a file, so but perforation I did. So what happened? A swelling, a big swelling without any pain. Was interesting because I was working with microscope and my assistant didn't mention that the patient became swelling. When she started not to see with her eyes, she just started to move as just mentioned something wrong. I want to say that the patient was not anesthetized and it happened without any pain. So of course what I did, a big panic. So what I did irrigation of a canal with saline water. I put ice application, and after that, as I told you, I sit on computer, Google, what to do more. This case is like 7 or 8 years ago, happened to me. So first of all, I injected dexamethasone straight to the gingiva, next to the tooth. I gave for her non-steroidal anti-inflammatory drug, straight in the chair, and I left tooth open. And for pain control, I prescribe at home to use some medication from pain. I prescribe for her to use antibiotics, some kind of antihistamines, and prednisolone as a corticosteroids. And that time was a protocol of my treatment, what I found it in internet about the treatment of adverse reaction. But nowadays, I don't want to say that my treatment was correct, because I'll say to you why. Oh, I don't know why. First of all, if you want to prescribe antibiotics, the case should be necrotic with pus or something to avoid infection, secondary infection. So in many of cases, you don't need antibiotics. You don't need antihistaminic, so it's not allergic reaction. And of course, you no need any medication except non-steroidal anti-inflammatory drug. So, rinse, canal, left open, let go exudate, put ice, cold, prescribe what to do at home of patient, and anti-inflammatory drugs. That's all. Success is a result, I'm next to finished, of perfection, hard work, learning from failure, loyalty, and persistence. So it never happened for me again, but never say never. So thank you for your attention, and I want to invite you, everybody, to visit Lithuania. Next year, in the end of April, we'll have a big Pan-Endo Global Symposium. Here's the page. Here's the page. You can go to visit and to see all the information. We'll have many of well-known speakers from United States. And the key topics, the same, all about endodontics. And the same, you could have a very good possibility to visit and to see by your eyes that beauty what I have told you last time. So thank you again, and have a good evening.
Thank you very much for a stimulating presentation. I think we have a minute or two for questions until we set up the stage for the next speaker. Do you have any questions? Please, we have only 1 minute. Go ahead.
Your first lecture, you say that the sodium hypochlorite put on the refrigerator. Why in a cool and dark place?
Yeah.
Why?
Because with the light, it's decreasing pH. And pH is very important if you want to achieve effective results. It's very important, pH. You never know, even if you open your bottle, you don't know what exactly percentage of concentration and pH are in this solution. So always close in cool and dark place. Keep. And prepare just as much as you need for that treatment.
Okay. Thank you very much.
Contact time of sodium hypochlorite? Oh, it's a very good question. It's not written anywhere, as long as possible, because you cannot leave for 5 or 10 minutes. But every time when you're doing instrumentation, when you're opening your canal system, just refresh or do refreshment. What I like, maybe I like continuous irrigation when you have all the time irrigation. And what I like is dual rinse technique when we have a sodium hypochlorite and halatic agent together. So we are creating a smear layer and taking out at the same time. So this is not written. I don't know who can answer how long the sodium hypochlorite could stay in the canal.
We have to catch second time. We can keep an open discussion towards the end of the sessions. We want to stick to the schedule. Thank you very much. Thank you, Doctor, for your. I'll take this from you. So you take. Okay. Thank you very much. And this is the presentation.
Thank you so much for the lovely lecture.